I am going to record this. So for my students, you don't have to put my name. I know who you are. But everybody else, make sure you put your names in the chat. And if you're not my student, will you put your professor in there, and I'll be able to copy that and paste that for all the professors. All right, so we're exam 2 we're on. For anyone that had some troubles with exam 1, I would always suggest meeting with your professor before your exam this week, because we write the exams and we know what's on there, so we can help guide you a bit. Study guide is what we're going to go over today. I want you guys to focus on the study guide with your studies. Are there any questions before we start? It'll be 50 questions again. Proctor U, which is what you guys use for the exams, correct?
Yes.
So they have just come out and said that they don't want paper on your desks. So what I will tell you is that they said they will take white dry boards. This has nothing to do with us. I just read an email from them. So just like as a heads up, plan not to use paper on your exam day, okay? Because I think they flag it in their system or something. All right, what we will go over the different parts of the exam guide. What I have done is I did a PowerPoint for you guys, and we'll review the topics. That always seems to work best. Any questions though before we start? 5 math questions, by the way, as always. Okay.
I have one question. The Cahoots for exam 1, it seemed like we had one for every week. This week we've only received 1. Will we have more?
Probably if they weren't used in class. I don't know. I would ask your professor directly.
Okay, thank you.
I don't share Cahoots primarily. What we do is, if you guys want to watch our recordings, I'm happy to send out our class recordings, and the Cahoots are on there. But I don't speak for everyone. I only speak for myself, okay? Because we all try to do the same thing, and we all have the same material. So we just probably teach a little different, I think, if that makes sense. Okay, so we're gonna start with I'll share my PowerPoint with you guys, and first I have 2 separate ones for you. So the first one we are going to look at is about health disparities. What you know about health disparities is going to be that we have social and economical factors that really impact them, like our economic stability, which will have to do with our debt, our medical bills, our support, those kind of things. Neighborhood and physical environment, like our housing, transportation, playgrounds, parks, things like that. Education, like language, literacy, those kind of things. Let's see, food, like our food security, access to healthy options. You know, I talked to my class a little bit about McDonald's. You can get a meal for 3 people. They have $1, I think it's a $3 menu or something like that. I really like diet soda. That's why I go to McDonald's. I don't go for the food, but anyway, they have like $1 menu. You can get, you know, food enough for $1. So if you're really having financial difficulties, your food is, you're going to see that. We see that lower income really parallels our health disparities. So when we take a look at poverty, what's the impact? Group at highest risk are children, minority and ethnic groups, and single parent families. We see Hispanic has an increased rate with poverty. Remember, when we're looking at college degrees in our rural areas, we're going to have lower numbers of college degrees and a gap then over time. What does this do to unemployment, do you think?
It's expensive to go to the college if you are no have enough support. If you
Sure.
don't save
Yeah,
money
it's expensive. Yeah, but what are we going to see with unemployment in our rural areas then?
Increase.
Yeah.
Oh.
You'll see a direct increase, because the lower education, the higher the rate of our unemployment. And then we look at our migrant workers. Remember, in our rural communities, we're going to have decrease in health status when compared to urban clients. They're less likely to do activities in their free time. They decrease compliance with safety such as wearing a seatbelt. They don't do preventative health screenings. So we see chronic disease is more prevalent. And know that there's a lack of reporting in this group, less likely to report any type of assault, depression, mental illness, anything like that. Because everyone talks is the thought. Rural communities, we have travel distance as well as availability. So what does that do to our resources? It's going to
Decrease.
Yep, going to decrease our resources. We don't have as much leisure time. We're doing farm work. We're taking care of livestock 24/7. Anyone who's done any farm work knows this. Everyone knows everything is really the concern with the rural communities, less likely to report, like I said, decrease in health status and no preventative. So we kind of overlap on these two. Then when we look at our migrant workers, we have primary, secondary, and tertiary prevention. What are we focusing with our migrant workers?
Safety.
You guys remember it starts with a P. If they're working in the fields, like we're looking at here.
Safety.
That's not going to be our priority, but
Protection.
Prevention.
well, prevention, yeah, but with what?
For
PPE.
pesticides.
Yeah, good. Whoever just said it, I didn't catch who it was, but good work. Pesticides, we're going to worry about those pesticides. So we're going to do primary things. We're going to teach about it. We're going to screen, and we're going to have, have things ready for them if they need to be treated, right? Remember, we see in the Hispanic population, we have an alternate use of treatments. Communication is going to be a barrier. Remember, we're going to see different groups that use herbal medication, teas, that kind of thing. All right, we look at our vulnerable populations. You guys should be working on your week 9 assignment at this point on a vulnerable population. But so we have the economically, we have migrants, we have low income, elderly, homeless, and those with chronic or severe mental illness. With our homeless families, we see the largest group growing is going to be families with children. Single motherhood is increasing with our homeless population. And we see that resemblance here, that correlation with education and poverty. Poor teens are going to be more likely to be impacted in the school setting. And we have, when moms are given a help or it's helpful, then we try to teach our adolescent kids, keep them in school so they don't lose that gap. Poor teens are going to be more likely to drop out of school than their counterparts. Think about teen pregnancy. We have premature birth. We have health risks. Education's being interrupted, right? So just try to remember these kind of things. Oops. What happens with our homeless and healthcare? What do we see? Where do they go?
The community outreach, like stations rather than the hospital.
So they're actually gonna oftentimes go to the ER, and the reason for that is because it's the fastest, quickest, easiest, only thing they know of. So you're going to see healthcare, the homeless is usually going to be in ERs, and it's going to be crisis, like their foot's falling off, or they have a sore that's now, festered into other things. Know that the cost of service is very high, but we have lack of money, lack of insurance, lack of transportation. So they're going to access these facilities more so. Substance abuse is part of our vulnerable populations. We are going to have objectives with this that we want to focus on, like increasing the proportion of adolescents not using substances. And then once we are going to look at reduced tobacco use and reduce the proportion of non-smokers exposed to secondhand smoke. So that's where we're going to really focus on that group for our objectives. We know that we have with substance abuse increased stress due to lack of jobs. So what ends up happening now, we're seeing a lot of self-medication. So we're doing like depressants and you know, things like that. We see an increase with caffeine and alcohol because this is a legal way to sort of deal with concerns if that's what you're having. We're going to look at 3 ways that we see prevention with substance abuse. Our primary, we're going to be preventing that initial use. And what are some ways we can prevent the use?
Early education.
Good. You're going to educate those school-age kids, right? So they don't even get involved. Then we go to secondary. We're going to see early detection and reduction of substance use once we have once problems are there. And then our tertiary, excuse me, is where we're going to be reducing the substance use and helping with rehabs and things like that. Oops. Vaping. This is a big one. We know it's marketed as to help quit smoking, but what we found is the oil in these vapes is poisonous to children. So therefore we have to be really careful. Any questions on vulnerable, substance abuse, any of those? No. Okay, then we go on to our faith and our parish nursing. We have congregational base, we have institutional. Remember, our congregation base is really going to be working with that one congregation, where our institutional base is going to be bringing in other people that can help the communities. We have parish nurses doing all kinds of things. They do sessions at the church. They can get with surgeons, voluntary agencies, healthcare providers. They pray if people want to pray. They make referrals. They help to reduce hospital readmissions, and they can do home visits, which is really good for our clients. How does our community health nurse act as an advocate and case manager for their patients? So we look at what we can do as a community health nurse to be a case manager. So we're going to make sure that we give that education. We're going to coordinate appointments. We're going to do all kinds of things like that. And different levels of prevention that we see in a faith-based community might be with fitness and activity for use. So we're going to look at their nutrition and weight status, proportion of work sites that offer nutrition or weight management, reduce their proportion of kids that are going to be obese. So we're going to do that through healthy eating, educating, things like that. Sort of on the same week as we did parish nursing, we did faith and hospice nursing. We want to remember that our goal with hospice nursing is to help maintain dignity and comfort. Okay, any questions on that? All right, we're going to go to our second PowerPoint. Not that one, hold on. Let's see. There we go. All right, and then, oh, hey, now what did that just do? Sorry, guys. Okay, here we are with this one. And we're looking at nurse management care plans, things like that. Remember our ADPI, we're going to identify our different steps when we're doing case management. So our first thing we're going to be doing when discussing health problems and limitations, we're gathering history. And whenever we're gathering history, that's our assessment phase. And this is going to allow for formation of a diagnosis. We want to make sure that we steer the, yep.
Sorry, Professor. I'm not seeing your PowerPoint. It says that you're sharing, but nothing's coming up on my end.
Does anybody see it?
Yeah, I see it.
I
see it too.
I do too.
I guess it's just me.
Jeanette, try to refresh.
Okay.
Okay.
I'm gonna try to log out and log back in then. Maybe
Okay.
that will help.
Yep, I'll
All
let
right.
you in. Yep.
Thanks.
All right, sure. And then when we look at our, oh, I'm sorry, hold on one second. Okay, sorry about that, guys. Okay, so steering conversation toward goals. The nurse is now able to work with the client. Planning would occur after outcomes have been identified so that a plan can be established as to how the outcomes will be established there. Okay, let's just move me up a little bit. Medicare coverage, you probably will see something on Medicare. I will talk Medicare and Medicaid, the two different things. So I want you to remember that with our Medicare coverage, client must demonstrate the need for skilled nursing care to get home services. Caring for a new wound. Caring for a new wound and teaching family members how to provide this care. Demonstrates need for a nurse to be in the home. So provide, it's got to be a skilled care. Can't be somebody who's going to come and sit or, do something with like activities of daily living. Medicare will not cover that. Okay, so we want to remember that home services, they have to be skilled services. When we look at Medicare versus Medicaid, remember Medicare is going to be our people over 65. They have hospital services, medication and prescription plans, low monthly premiums. When we look at Medicaid, it's our low income families and individuals, and those with long-term disability can be seen also with our Medicare. Hospital services, physicians, they all that. Medicaid is no cost for most things, like for example, an ambulance ride for private insurance is usually pretty pricey, but when you have Medicaid, they'll cover that for free. So things to think about when we're looking at those two. And we talked a bit about home nursing. Of course, we know we're going to look at our safety. What are some things that we think about as nurses that we need to be safe with when we're in the home? For ourselves.
Maybe like taking away maybe things that'll make you fall, like floor mats and all that stuff.
Yeah, that's going to be for our patients, but what are we going to do to make sure that we're in a safe environment when we're in someone's home? What are some things to do?
Make sure that
Okay,
you're
the exit.
between.
You have to do an inspection or ask questions. Do you have this in your bathroom? Do you need anything with assistance?
Yeah, guys, you're focusing on the patients. I want you to focus on nurse safety first.
We have to notify someone like from our facility job or let them know the time we're actually going in, check our surroundings, try to leave our purse, don't take anything in, make sure that if it's like a dangerous area not to go in or scenarios like that.
Good. And on our last test, I think we had a question about bringing somebody with you, remember? And while in practice, we oftentimes don't have that ability, but if you have a volunteer, you'll bring the volunteer, things like that. Just think about safety. You're going to sit near an exit. You're not going to sit, in the farthest away from the door, right? Those kind of things. So I want you to think about safety in two different ways. When we're looking at safety, you guys touched on some things for patient safety. Make sure that, watch the floor mats, watch for the refrigerator working. They know to turn on and off the oven, those kind of things. We look for carbon dioxide. Carbon
Dioxide.
No, carbon monoxide. Sorry. And then we're going to look for molds, falls, medication storage, and, types of cleaning products. Make sure they're stored away somewhere. What's something we're going to look at if kids are in the home?
The medicines are locked up or away, out of the way.
Yeah. What else do we worry about with kids?
Guns are in a gun safe and locked.
Good. And what else? What else do we worry about kids that we just talked about? Something that is poisonous for them.
Refrigerator as well, to make sure that they have like food in the fridge.
The vape cartridges.
Yeah, you're gonna do all that. Vape cartridges is what I was thinking, Kara, but yeah, all that you guys said is true. You want to be careful with kids for all that stuff, okay? We did epidemiology. My class did it last week, so we know it's a study of why are things happening, and we use this to help control health problems, right? And oh, hey now. And we have an analytical, which is gonna look at the origin or what's causing it. Like, how does it occur? Why are some people more likely to get it than others, right? That's gonna be our analytics. So we're gonna look at what's going on, what's causing this to occur in groups of people. I want you to know, why does it keep skipping that slide? Okay, I want you guys to know this definition, okay? Case fatality rate, also known as CFR, is going to be our proportion of persons diagnosed with a particular disorder who die within a certain period. So it's the number of cases fatality doesn't survive over a certain rate or period, okay? Estimated risk for death within that period for a person newly diagnosed. So you can say most people, survive this, most people, don't. So a lot of times people want to know this. And so our case fatality rate is going to be something important because we'll be asked that by patients. When we look at our environmental health, remember kids, our key with the kids is going to be lead. We're going to minimize our risk to human health and hazardous sites, reduce our pesticides, reduce indoor allergens, decrease the number of US homes with lead-based paint. These are some of our motivations. Occupational health we did last week as well. What does the occupational nurse look for in the workplace? What is really the goal of an occupational health nurse?
To prevent injury.
Yeah, keep everybody safe, right? Safe, healthy. What are we going to look for as an occupational nurse?
Make sure we teach the new technology, how to use it.
Well, maybe, but that's not really going to be an occupational nurse. That's going to be like, just a nurse that's working in the hospital for maybe IT or things like that. So what are we looking for with occupational health nursing? Remember, we talked about, go ahead, Kim. You're going to say something, weren't you? We look at ergonomic chairs, right? How are we sitting? Where are we standing? Sorry, it says my internet's unstable. I have no idea why. Right? How we're standing, how we're sitting, if things are where they should be. What else are we going to be looking at? I'm just looking at to see to guide you guys a little bit here. What other things are we going to be looking for? We're going to be looking to make sure that we have the right gear on, if there's fire, right? Things like that. All right, and then we go back a little bit to epidemiology again, because we talked about this triangle. Remember the three parts. We have our agent, our host, and environment. They all kind of work together. If the agent changes, then the host and environment can change. If the environment changes, then the reaction of the agent to the host may change. So what's an example of an agent?
Isn't that the causative factor?
Bacteria, virus.
Yeah, bacteria, viruses, it's whatever's working there. Our levels of prevention, remember primary is going to do what?
Prevent.
Yeah, prevent. Secondary is going to do what?
Screening.
You got it. And tertiary is going to do what?
Treat.
So I will tell you there'll be a question or two on that one. All right, and then we focus a little bit on our types of studies. In my class, we had a graph that we went over from the book. So no, our ecological, quick, easy, inexpensive. What it does is just really gets information. It's like such as data on exposures, characteristics, and outcomes. We're not doing the real, we don't have our real deep there. Cross-sectional is going to be our general description of the scope of the problem. It's going to provide some preliminary evidence, right? Looks like a cross-section or a group of people. Information is collected on their current health status And then we see, was there any exposure to anything or risk factors that happened in the cross-sectional studies? We're gonna see, oops. We're going to see, and guys, I want you to know the difference between all these. I'm just trying to move myself so I can see whatever. Oops. So we know that in cross-sectional studies, we're going to be collecting a bunch of different stuff to see where our exposures lay there. Retrospective, now we're going to have exposures and outcomes. They're going to really rely, retro meaning previous, we're going to see that to be studies that rely on existing records, you know, hospital records, insurance, employment, to define that it's either something has been exposed or not exposed. And then we follow them over time to see if the outcome has occurred. A little bit more with environmental health. We know that we're really looking at the environment and how that's impacting our clients. Occupational nursing, I asked you guys a little earlier, what are some things that we see they do? And so we're going to see they're going to reduce, you know, work injuries, rate of injury and illness. We're going to reduce deaths from work-related homicides. So we're going to do some mental health work there, work-related assault, and increase the proportion of people that have access to work sites that will provide that. Kind of talked about this. OSHA, remember our friend OSHA, what it is, Occupational Safety and Health Administration. What are we going to do? Make sure that they are doing. They're going to create and enforce regulations to keep the occupational areas safe. We also have the National Institute for Occupational Safety and Health, and they're going to do more research and education, okay, where OSHA is going to give us guidelines and everyone has to follow them, right? We all should be familiar with OSHA and National Institute for Occupational Safety and Health.
What does the second one do again? I'm sorry.
The Department of Transportation or National Institute for Occupational Safety and Health?
The safety and health.
Yeah, so they're just going to do research and education. Okay, they're not going to be making rules for what to enforce in facilities.
Thank you.
Sure. Okay, so that brings us to the end of my PowerPoint. I'm going to stop sharing right now and see what kind of questions do we have out there. Let's take a quick look at our study guide because there was a couple things I did not cover. And I want you guys to know about this. Quality and Safety of Healthcare is going to be an agency. That agency is for healthcare, Agency for Healthcare Research and Quality. Is going to be who is responsible for improving our quality and safety in our healthcare. Remember our case fatality rate and what that it represents. What kind of things are we going to look for in our adolescents if we're doing primary prevention? Or secondary, let's say secondary. What kind of screenings are we going to do on our adolescents?
Would it be alcohol?
Could be alcohol, what else?
Sex, like,
Drug
Yeah.
screenings?
Yep, tech just answered. Good work. STIs. We're going to be looking at our sexually transmitted diseases screenings, right? On our adolescents. Because that's a time when they try to experiment and do different things that maybe they, you know, are prepared, maybe they're not prepared, who knows, right? What else? What did we say our Medicare reimbursement needs to be for home health?
skilled nursing services.
So skilled nursing services. So it's not going to be cleaning the patients, not going to be putting clothes on them, right? It's going to be treating something medically, right, for a reimbursement. Know that Medicare, Medicare is gonna be federally funded, Medicaid is gonna be administered by our state. We're gonna have, homebound really for qualification for Medicare for services in the home. What's our focus of hospice care?
Comfort and dignity.
Comfort.
Comfort, dignity, right? Which is more autonomous? We went over this in my class. Congregational or institutional? Which is going to be more autonomous on the role of the nurse?
Congregational.
Good, because you're just dealing, very good. You're dealing with that one group of people, where you're institutional, you're working with lots of different people, so it's not going to be as autonomous. Good. What else? I'm just looking at a sheet that I have printed so I can make sure we cover everything. We know our biggest substance abuser, the highest rate of death is going to be what? It's one that sells legally for over 18 in this country.
Marijuana.
Alcohol.
Never mind.
Cigarette.
21.
You got it, Michelle. Smoking is going to be our #1 killer. Okay. Who's our biggest group growing with that homeless population? Sad, but true.
Families,
Families with,
children.
good.
Professor Alani, is that just a study guide you sent to your class that you're looking over?
No,
was
you
it
guys
pre-
have the same one.
I don't
We all
know.
share the
Prof-
same study guide.
Is it just, I don't know if I received it.
I can send it. I can attach it in the chat if you want.
Yeah, thanks.
Sure. It's the same one everybody got. We all share the same study guide. This is what the study guide looks like that I'm looking at right now. I just like to review it. Ooh. No. Let me see if I can find it here. Shoot.
Do you know about when it was shared?
Last week, maybe? I shared it with mine as an announcement early last week. So you guys should have gotten study guides. Let me just, you can't see my screen, can you?
No.
Okay. I just want to, because I don't need you guys to see all what's in my Word documents. I'm just going to open it up for us. Actually, probably easier for me to go to my posting on my announcement. Let me do that. My class, when, do you remember when, I posted it on August 5th. Yeah, a week ago. So you guys should have had it posted to you guys about a week ago. It's a Word document. It says exam 2 study guide.
No, I just went through my announcements. I have Professor Apple and she just had something about, the grades on the 5th. And then I got the PowerPoints for the week 5.
Here, okay, so I'm gonna open it for us so that everybody can look at it. If you did not get this, it's a Word document. I will, she actually was just texting me, Professor Apple, so I can ask her if she shared it, but
Okay.
put your email in the chat and I'll send it to you at the end.
Okay.
Okay, so here is our, I don't know, there it is. Okay, so it should look like this, guys. It's all inclusive, it says. Let's see, we're going through consequences. It really parallels what I talked about. Back in neck pain, we know with our rural workers, muscular skeletal is something that we pay attention to. One thing that was not in our PowerPoint was the Shepherd Towner Act, which is something that is on here, and I would like you guys to know that. Where is Shepherd Towner? Shepherd-Towner Act is going to be, an act. Anybody remember what it does? No? We
What
talked
do you
about it in my
think?
class, I know that. It's gonna have something to do with. Well, I'll wait. Anybody come up with what it has to do with? We talked about it 2 weeks
It has to
ago.
do with like prenatal care. For
Yeah, we started
infants.
out with prenatal care. What kind of things did we see? It helped us to do what? What kind of screenings was it part of? Remember, it's public health policy. Health services to women, children. Right? It helped to define our role in government,
Welfare.
and research.
Mm.
Created standards for screenings. What else did we not go over that's on the study guide? Most of this was on my PowerPoint, but I'm just looking. What are some risk factors vulnerable people use for alcohol, tobacco, and other drug uses? What are some things? What are some things that are going to put somebody at risk for alcohol, drug use?
Where they grew up, their family history.
Good. Family history. What else?
People's social life.
Yeah, peer motivation, the peers.
Yeah, I see what you're saying. If you surround yourself with people that are doing it, sure. But remember, we're thinking about, addiction is going to be genetic. So we talked about parents with addiction. Good. Tech just said violence. That's another one that we look for. What group of our vulnerable population is going to be susceptible? I'm sorry, hold on 1 minute. I just have to plug in my computer.
Maybe mental health.
Good, not maybe, definitely. Good. Mental health is going to have that relationship there with our substance abuse. What else? Let me look at our study guide again and see what else I want to cover. Like I said, what's on here, I want you to focus on. Well, we talked about a couple extra things that I told you. I think I want you to know, like our Shepherd-Towner Act, the different things that does. We're going to see examples of primary, secondary, and tertiary prevention. Okay, it's going to be a lot of our applying Medicare. Remember, we need skilled nursing, and we know that homebound to qualify for that skilled nursing care, because otherwise we'll need that. What other questions are out there? Did everybody put your name and your professor in the chat? I'm going to copy it now.
I have one question about the recording.
Sure.
Last exam, I looked for your recording, but I didn't find it. Where are we posting those?
Well, all professors should be posting recordings, and I post mine under announcements. So what ends
Okay.
up happening at the end of this recording, it will save as a file, and then I send an email to your professors. So depending on how they post it, I'm not really sure. I mean, sometimes they may email it to you, or they'll post it as an announcement. That's where I would look for that. Sorry about that. That's not helpful, huh? Not to get the recording. Any questions out there on what's covered on the test, what you guys should study, what you should be familiar with?
No, just be sure to maybe to send me that study guide because I don't think I got it. She posts the recordings of everybody's reviews and those are helpful, but I don't think I got the guide. So
All right, Carrie, you put your stuff in the chat.
yeah, I did.
She said she was gonna give us the guide on Thursday, but I haven't seen it yet in the announcements either.
Okay.
Tammy, is that you?
Yeah,
You're Professor Apple?
yes, ma'am.
Okay, I'm gonna text her right now.
Can you just explain one more time the act that you were talking about?
Sure, the Shepherd Towner Act, absolutely. Remember that was in the 1920s is when that came out. And what we look at with that is that it was for developing public health policies, really the first start of it. And we saw that it helped provide health screenings to women and kids. And so we had early developmental screenings with it. We had a role of government and research with it. And we had a way to collect natural health statistics. Those are our three major things that we want to focus on.
Okay, thank you.
Good. Great. I'm gonna just copy everybody in the chat here, make sure we have all recording. I will text Professor Apple and remind her. What else can we go over, guys? Anything? Do you want to go over a Kahoot? It doesn't go with the exam, but it's with some of the chapters if you want.
Okay.
You guys want to do that?
Yeah.
All right, let me find a good one for us.
Professor, you say like a family and with children are a big group of vulnerable people.
No, they're increased for homelessness right now.
Oh,
Families with kids are increased risk of homelessness. Our largest group.
thank you.
You're welcome. All right, let's look for a good one. Let's look at. Oh, this is a good one. You guys want to do evidence-based practice? Have you done that one in your classes? No. I like this one better. We're gonna play this one. Okay, so does everyone know how to Kahoot? Everybody know how to do it? Right, so I'll give you the pin in just a second. Still loading here. All right, here comes our pin. 346945. You can put whatever name you want in here. It's not gonna impact you in any way. All right, we'll start here. All right, what's OSHA? We just talked about this. Okay, so on OSHA, you guys got it right. There was two choices. I didn't give you that heads up, but it's gonna be something that protects their workers, and it's also known as the Occupational Safety and Health Act. Good work. What's our mission of OSHA? Remember, which of the following best describes it? Good. We're gonna have our safe and healthy working conditions, right? We're not worrying about employee safety only, we're worrying about the entire unit. Multi-select. So this is gonna be more than one answer. What is the goal of the World Health Organization? What are some things that the World Health Organization is gonna do? Oh, we were torn there. Remember, World Health Organization is not going to be worried about peace and safety and all that. They're a World Health Organization. So what they're going to focus on here is health. So if you knew nothing about the World Health Organization, you know that vaccines are part of our health and drug reactions are part of our health. So that's how, if you didn't know anything, remember what this is. The World Health Organization gives us guidelines that people follow all over the world. So we have standards for when vaccines should be given, what age, what side effects, those kind of things. We know that the World Health Organization is going to make sure drugs that are approved are all, we're not going to have support to middle income countries. Nope. This World Health Organization is directly related to health. That looked like that was a hard one. All right, over 65, what do you need for Medicare reimbursement? All right, good. Remember, whoever picked blue, no, it has to be a skilled nursing act, remember? So bathing and meal prep is not a skilled nursing behavior. Okay, we don't need a nurse to do bathing or meal prep. All right, Medicaid, we know is going to do what? There might be multiple answers here. Alrighty. So it's not funded by, Medicaid is not funded by the state government, it's run by the state government. It's funded, Medicaid and Medicare are both federally funded programs. But one is run by the federal government, one's run by state. Think about the way to remember that is Medicaid. I don't know if anybody's familiar with what Medicaid is called for kids, but here in Colorado, it's called CHP. I know some of my students in Florida said it was something else. What do you guys know about Medicaid for kids? What is it called where you guys live? Anybody know? No.
Kid care.
Yeah, right. So you have kids care, you have CHP, you have all different names. So that's one way to remember that it's really run by the state, but gets money from both. So really gets state backing. We understand differences based on ethnicity and economic circumstance in order to do what? What is directly related to this? Excuse me. Very good. Awesome. Everybody got that. That's related directly to our health disparities. I'm gonna skip that one. Ethical foundation for evidence-based practice, we know lies in what? Remember, ethical base. What's our goal with evidence-based practice? Oh, that's funny. 1, 1, 1, and 1, and 5. So our goal with any evidence-based practice is always going to provide information so that we have documented effectiveness. Remember, when we talk about evidence-based practice, there's oftentimes a hesitation on the behalf of the nurses. They don't want to change what they believe, things like that. So remember, it's not requirements related to our code of ethics necessarily. We're not gonna talk about the code of ethics. Case law establishing liability issues for undocumented, no, has nothing to do with law, particularly when we're speaking ethical, right? Alrighty. That's an interesting random question. Multi-select, so there should be, yeah, we're gonna go a little bit into liability, I see here, so let's skip this. No, this is a good review. What's the definition of malpractice? Good, almost everybody got it. Failure to give the care that is expected there. It's not bad practice, it's that something has not been given that should have been given, right? Which could be determined as bad, but that's kind of vague. All right, we're working with a vulnerable population. What action should the nurse do when providing care? Oh, we only got 4 answers. And everybody picked something different. No, with our vulnerable populations, we're gonna have to do long-term care with them and create relationships with the families who are gonna help support our vulnerable population, okay? No, as a case manager, you're gonna have to work with lots of different people, lots of different phases. What can your case manager do for you? Think about what a case manager does for their clients.
Okay.
Good. We had 2 answers there. We didn't have a heads up on the 2, but help you set and meet goals. We want to help with self-determination. We want to inform, we want to support, and we want to affirm, right? Good work there, guys. All righty. Any other, we're gonna stop our Kahoot here. Any other questions out there?
Professor, where I would like to practice questions, like to understand sometimes, because to understand the type of questions, because I don't know if as anywhere that any links that I can
I would,
visit.
if you want review questions, I would look through your NCLEX book. The problem is going to be that they may not be broken up the way our chapters are broken up. So you might have some questions that are going to be sort of,
So should over with all the questions for these 50 questions, do all of them? I think it's 198 questions.
for your NCLEX review.
Yeah, I mean, you guys says
Well, what
do
I
the
would do is go
assessment.
through the NCLEX questions and answer the ones that are related to the topics that we've covered for this exam.
Oh, okay.
Does
I
that
will
make
do
sense?
that then.
Don't
Yes.
do 200 questions on random stuff. That'll be a waste of time.
Oh, okay.
But I will tell you, these questions are not necessarily going to be just recall, guys. You got to learn to apply and put them in situations and then, understand the concepts on top. So just remember that when we're doing that. Somebody wanted an example of a math problem. What I'm going to tell you guys about the math problem, because there's 5 different ones. And they're all going to be, very different. So what I want you to do is I want you to practice on that math, what's it called? Skills and math practice or something. What you guys have, you have a resource. Just practice some of those. It'll be like IV conversions, things like that. Let me see if you need to know pounds to kilograms. I mean, you guys should know that by now, but no, it doesn't look like you're going to do a weight conversion. Okay, but you are going to want to make sure that you have that down, what you're doing. Make sure you're rounding when it says round to whole number. I don't like to do math because the way I teach math may not be the same as everyone else. So drip factor, I'll look, Cindy. Yeah, I would know that. Okay. All right, guys, thanks for a good review session. I hope it was helpful. I will send to Kara. Oh, Kara's gone, but I'll send her the study guide.
Professor, I'm sorry, when would you be posting this review?
Like I said, I have to, so when I end this, it'll like download to YouTube. And then once I get it downloaded to YouTube, by tomorrow morning,
Perfect, thank you.
it'll come in our announcements. Okay.
Okay, thank you.
Okay. All right. Good night, everyone.
Okay, thank you,
Thank you.
Professor.
You're welcome.